Excellent. Welcome to Fertility Fact or Fiction. I am your host, double board certified reproductive endocrinology and fertility specialist, Wahi Victory. And I am on with Tarek Ibrahim, my esteemed friend, colleague, and all things social media. We decided not to do a topic tonight to give you guys a chance to ask some questions. And we had a little excitement up the road where, unfortunately, there was a pedestrian accident. And so I actually scurried off in the time when I was supposed to try and prepare for the show to help do chest compressions. But in any event.
Am I allowed to say what? No, just joking.
Let's not get ourselves
I'm not going to set
in any kind of trouble.
No.
Yeah. So, the show went a little sideways on us, but here we are. So we are good to ask any questions. There's one that was actually sent on my Instagram ahead of time, which was, what should I do if I've had a vasectomy and I want to get testing done? So assuming you've had a reversal, the only testing you can do is a semen analysis and an anti-sperm antibody test. So the semen analysis is just the basics because you want to know how many sperm there are, how many are moving, what kind of progression they have, which is how fast they're moving, and then of course how many of them are normal or abnormal. But the other thing that you can't see on a normal sperm test is how many of the sperm have anti-sperm antibodies on them. Because once you've had a vasectomy and then a reversal, you actually do end up with these antibodies. And the longer you've had the vasectomy until you get the reversal, so the interval between initial procedure and reversal, the longer that time limit is or time frame is, the higher the chance you'll have these antibodies. And it can get to the point where it can really mess up or prevent your ability to get pregnant. So basic sperm test, anti-sperm antibody test, it's called a MAR test, M-A-R. And then basically go from there. There are other tests that can be done, but those are the basics. The other thing I do need to tell you all is that MyStoria is now launched, and we have a code which is MyStoria Dr. V25, which gives you a 25% discount. So make sure you go on MyStoria and sign up because they are an excellent resource and tool for helping you guys to kind of get your fertility care reevaluated. Basically, they're an extra, addition to your fertility journey where they will help you online, almost like a fertility coach, but not quite. But they're online to help you get your second opinions, get your resources, include you in a community, blogs. There are people there that can actually help you through your journey, point out things that have gone wrong. And I'm involved intimately with them, and we're partnering with them over some projects. So MyStoria, MyStoria, check them out. You can sign up now. It's a phenomenal app, and it's going to take the fertility world by storm. So make sure you go on there and take a look at that. Questions already?
Yeah. What show do you think this is? The Don't Ask Questions show?
Yeah, this is not the Don't Ask Questions show.
All right, we'll start with Instagram. Let's have some fun here. Hey, Dr. V. That's this. Looking forward to this. People are excited. Hey, Dr. V and Dr. T. It's kind of about time we go back to Dr. T.
Dr. T.
I kind of felt neglected for a little bit, but now I'm feeling medical again.
Dr. T came and saved me from freezing to death when I was out seeing what happened.
Isn't that the job of? Isn't that the oath that we take to help?
That's the brother oath. Yeah.
Yeah. So sure. That's my thing. Dr. Vinti, I did a sono right after a CD130 biopsy. Is it possible tissue shows up on the sono that's from the biopsy?
Oh, that's interesting. Yeah, I mean, if they did a really aggressive biopsy and they tore some strips, you might get some irregularities in the lining. So yeah, I could see that happening. It's definitely a possibility. It's not something I would expect to happen routinely, but it definitely could happen. Yeah.
Hi, doctors. You catch that? Hi, doctors. That's for both of us.
Just so all of you know, for years now, he's been making those faces at me the whole time off camera. Now you all get to take part in that.
It's part of the caring to sharing kind of bit.
Sharing.
Yeah, that's right. Hi, doctors. What are your thoughts on Tdap vaccine during pregnancy?
Oh God, I shouldn't answer this one.
You want me to do it?
Yeah, I know. Okay, so the technical answer is that all the current guidelines and societies recommend that you get the Tdap vaccine. My personal answer is that when I looked up the data, and this was some time ago, it showed that there were 13 per million people that, or million babies, I should say, that actually ran into trouble from complications related to pertussis infections in early birth time. So, like, that's a lot of people to vaccinate to avoid 13 babies that run into severe morbidity. So, I mean, I'm not saying it's not worth it. Nobody wants anything harmful to happen to a baby. But we're talking about vaccinating 999,987 people unnecessarily for 13 babies. So I don't know that the math really like favors that. Even if you break it down into its most, basic sense, that's 1 in 70,000 babies. So I don't know. I don't push it with my patients. I offer it to them because we're supposed to, but I never like enforce it on anyone. You want it, great. You don't want it, no problem. We won't do it to you.
Any idea on why my AFC and my egg retrieval counts are quite different? Blood work says I didn't ovulate, but I have only 30% of my baseline follicle counts.
Yeah. So this is a super good question. There are some people out there where the AMH and the antral follicle count, or AFC, just don't match. So we do find people where they have a high AMH, but they're really just not producing the right number of eggs. I've got one right now. AMH is relatively high, around 24, but she's only making like 7 or 8 eggs. Those two don't go together. If your AMH is 24 picomoles per liter, you should be making 24, 25 eggs. Why that discrepancy is there, no one has figured out yet. It could either be an error in the AMH test, or there's some sort of physiological difference in those patients where their AMH and their antral follicle count just don't go together well. So that is something really cool that I hope we get more research on. And I might start looking at our own patients to see what sort of unique features they have, because there is a subgroup of patients where that is the case. And it would be phenomenal if we knew in advance, because it would change and alter the dosing, the protocol that we use. Like some of those people, you end up having to prime them and give them DHEA testosterone, which I would never normally give to someone with an AMH of 24.
I only have 3 follicles growing, day 6 of stems, and they're 23, 19, and 15 millimeters. Is the 23 millimeter one too big and at risk of ovulating before retrieval? Is only 6 days of stems enough?
The 23 is already probably either post-mature or very close to it. Your 19 is mature, your 15 might be, but it might not be. There's no way to know. If you're not already on an antagonist or something that would block your ovulation, you're definitely very high risk with 2 follicles that big. And 6 days of stim. So there is a study from a while back that we shared on the show way back in the early days, which showed that if your stim was less than 8 days or greater than 12, like 13 plus, that the egg quality and outcomes were way, way less. So occasionally I'll trigger to get an early follicle like that, like 6 days of stim, but it's when we're only going for 1 follicle and then we're rolling into a duo stim. Otherwise, I would be concerned about that cycle because you've got quite a spread on the size of the eggs. It's going to be hard to know if you're getting the right ones.
So a question from Instagram, how do you improve egg quality at 42?
Diet makes a huge difference. Vitamin supplements make a difference. There are people out there that say it doesn't make a difference. You don't need the supplements, just jump right into IVF. That's actually not the case. Supplements, diet, exercise, acupuncture, yoga, they've all been shown to have benefits. So those are the things I would focus on. I would not let them give you a high dose protocol. High dose protocols just barbecue your eggs and they're useless. So I would avoid that at all costs. And then beyond that, it's just a matter of, making sure that you are not smoking, not drinking, You're not using any drugs, including marijuana. You are taking all the vitamins that you need. And of course, we always recommend the 4 basics. So your prenatal, your vitamin D, your coenzyme Q10, and melatonin, because all of those have been shown to actually have a positive benefit. Additional supplements depending on what's wrong, your condition, your health status, and so on. If you are overweight or underweight, then adjust your weight. So for underweight people, I tell them to gain weight. I told someone today. And for overweight people, we need them to lose weight as well.
A question from TikTok. OZ and TTC. Ozempic, is that what OZ is?
Yeah, probably.
Yeah.
That's the question. OZ and TTC.
Yeah, that is the billion-dollar question these days.
Yeah, so we talked about it. We just put out a post today, actually, on Ozempic and TTC. So Ozempic does not help you get pregnant. Everybody needs to understand that. There is no direct correlation between Ozempic and pregnancy. Ozempic causes weight loss, which then allows you to get pregnant more easily. And there's probably some reduction in inflammation. So people were asking us, what about for endometriosis? And the answer is, we don't know. It does reduce inflammation, whether it's directly through reducing your fat content or through a biological, physiological mechanism. We don't know for sure yet, but it does reduce inflammation. It definitely reduces your adipose tissue. And so between those two mechanisms, you are at a better chance of conceiving. Does it work specifically for endo patients? I'm not aware of any data yet that suggests that, although I think that would be super cool to look at and something that maybe you might hear us try. So yeah, we'll know about that. For those of you that aren't aware, we are currently running a randomized controlled trial of using pantoprazole for embryo transfer, and we are waiting to see what the results are. I'm not at the point yet where I can even do an interim analysis, so I don't have data yet. But you know, all the time you hear about the Pepsid and the histamine blocker protocols. So no one actually knows if those work. There's zero evidence. There's zero evidence for using Benadryl protocols. There's zero evidence for using the proton pump inhibitors. None, like absolutely zero. But I was at a conference where a lady that was doing basic science research presented data showing that they bathed uterine muscle tissue in proton pump inhibitors and it contracted less. And so they wanted to actually use it for preterm labor. And then I twigged in and thought, maybe we could use this at the time of embryo transfer. So we are running a randomized controlled trial. It'll probably take us about a year, but once we get the results, that could be a huge game changer for people because it's super easy to take, has virtually no side effects, and works really well. Although I will say, during the pandemic, I got my COVID shot, okay? And I'm sitting there eating my dinner, and I also thought I had a stomach bug at the time, like stomach ulcer, the H. pylori. And so I'm eating my dinner, and all of a sudden, my finger, white like the cabin. Whoa. And I couldn't feel it at all. And it is the worst feeling ever, because you literally want to like cut off your finger. Like it's such a weird, strange sensation. And I got a hot tea and I held it and stuff. And it took like a good 3 hours for the sensation to come back. And then I went and had like a whole bunch of vascular Dopplers and stuff to make sure I hadn't had like a finger stroke. And the guy said I had the blood vessels of a 12-year-old girl.
No way. Oh, no.
Yeah, that's what he told me. So I didn't have a vascular stroke, but yeah, it was wild. So, and then I looked it up. It's a side effect of taking pantoprazole, Raynaud's syndrome.
Oh, is that right?
Well, Raynaud's phenomenon, where you just lose sensation. It goes white. You get no blood supply. Like it's a horrible feeling. Horrible. You just you immediately want to like
go at it,
Go at it and take it off. Yeah, it was terrible.
What are your thoughts on my Fembry instead of Lupron plus letrozole for endo patients before an FET?
Completely, absolutely, no question whatsoever, useless. So I love my Fembry. It's in fact, there's a brochure right behind you there. My Fembry is a great product. I totally support my Fembry. I've done talks from my Fembry. I like the product, but it is useless in that case because the whole point of Lupron and letrozole is to zero out your estrogen level. Okay, Myfembree, which has a GnRH antagonist in it, already is not going to drop its religulase. So it's already not going to drop your level of estrogen substantially below where you would normally be in the mid-follicular phase. And then they put estrogen in it with progesterone, which gives you more estrogen. So that just makes absolutely no sense. It's like the people that say, I want to take Orilissa, their doctor puts them on Orilissa. Taking Orilissa makes no sense because it's not going to help. First of all, there's no evidence. And second of all, it doesn't make sense. It's keeping your estrogen in the mid-follicular range. That's a substantial amount of estrogen. It's not going to help you get pregnant.
What are your thoughts? I am 7 weeks, 5 days pregnant.
Okay.
At 6 weeks, 5 days, ultrasound doctor said is behind by 2 days and machine can't capture the heart pulse. But they saw it beating. My Treg cells are low. Can it affect baby growth?
Well, Treg cells being low is definitely associated with higher risk of failure and miscarriage. So could you benefit from something like lit therapy? Sure. Do you need to do that right away immediately? Nobody obviously knows, especially during pregnancy. But we would definitely offer you lit for a case like that, if and only if you had a history of recurrent failures losses. That early in the pregnancy, the heart rate can actually be very kind of difficult to determine and make sure that it's working or not working. So, or I shouldn't say working or not working, beating or not beating yet, because with a really top-notch ultrasound like the ones we have here, the GE Voluson 20, you're looking at, seeing the heartbeat at like 5 weeks and 6 days, 5 weeks. I think the earliest I ever saw it was 5 weeks and 5 days. So you're not going to see it much before that. And if you don't have that same quality of ultrasound, it can take those 6.5 weeks to see it. So I wouldn't panic yet, but definitely get follow-up ultrasound soon so that you know what's going on.
A question that gets asked often, I think, is what to do or tips for conceiving a baby boy?
There's absolutely nothing you can do that will alter the sex determination of your fetus, no matter what any crazy person on the internet tells you. There are entire websites dedicated to having boys, having girls, have sex on this day, have sex 3 days in advance.
Thursday, 3 p.m.
Yeah.
That's how you do it.
That's how you do it, yeah. So, all that stuff, it's absolute gibberish. There is no way to control whether you have a boy or a girl. Zero. So if you want to do sex selection, it has to be done outside of Canada. We can't even discuss it here. It's available in countries in the US. The process is simple. It's IVF with pre-implantation genetic testing, and then if you're using a boy or a girl embryo, and then you go for it. But you're not allowed to do that if you're in Canada or Canadian, because it's a federal offense, punishable by 10 years in maximum security, federal prison, and a $500,000 fine. So we don't even talk about it. Like, we don't facilitate it. We don't discuss it. It's not happening.
It's the equivalent of the death sentence in Canada.
It's pretty bad. Like, they take that seriously. They do not want people. And you know what? Okay. If you've got like 3 of one and you wanted one more just to balance out like that you wanted the other, like, I get it. I mean, I'm not opposed to that. The problem was it got abused, right? So certain people, without mentioning any specifics, don't like having specific genders, and they were terminating when they found out it was that gender, right? And that's obviously not cool. So because of that, the radiology group got together and they said, we're not telling. And then Health Canada said, yeah, this is a big no-no.
But there was an actual time when it was okay?
It was. When I was a resident, Jeff Nisker from London, he was an REI, he went to town on the ethics thing, and he said, no sex selection, no compensation for egg donors and surrogates, reimbursement only. All sorts of specialized rules that he brought in for bioethics. Yeah.
Interesting. Here we go. Here's a good one. They're all good ones, to be fair. They're all good ones.
They're all good ones.
Yeah. 39 years old,
Yeah.
2.69 AMH, just had the 3rd unsuccessful IUI. Cycles were with 5 milligrams of letrozole with 2 follicles. I went to add Gonadrop injections with letrozole, but my clinic is resistant adding the FSH injections. Thoughts? And then she follows up with in a previous video, a few years old now. So this is hardcore research going on here. Yeah. You recommended based on these studies to wait for a natural LH surge and then do a trigger shot. Do you still recommend this instead of relying on the trigger?
Okay, so mixing the pills with the shots has been proven to be beneficial. We actually reviewed that a while back. Having Menopur for even 3 days doubles your IUI success rate. So there's no question that that's a reasonable thing to do. It will improve the number of eggs you make to responsiveness. You'll probably make more than 2. I don't know if your AMH is in picomoles per liter or nanograms per mil. If it's picomoles per liter, there may be an egg quality issue associated with the fact that you have very diminished ovarian reserve. If it's nanograms per mil, you're still in very good shape. With regards to the trigger, so there was a study years ago which said, don't trigger, wait for a natural surge, and then do the IUI after the natural surge. So we switched to that, we tried it, and we were not happy with it. And then we started triggering again on our own. However, for people that naturally surge on their own, for whatever reason, let's say it's an early surge or whatever, there is a study from Hamilton that actually demonstrated a doubling of your success rate when you added in an HCG trigger to your natural surge. So generally speaking, we trigger when the follicles are like 18 to 20 millimeters for IUI cases. So that's our normal protocol. But if the patient's surging on their own, we will add in an HCG trigger shot. Do we let people naturally surge on their own? Not anymore.
Don't be shy to ask for likes and shares. People are getting their questions answered. They should be like so thrilled. Like share.
And thank you to all of you who have been following us recently. We really appreciate that. We do want to hopefully go viral one of these days. We've been trying for years. I think Instagram finally kind of recognized we've been trying, so we seem to be getting a little more.
They're our friends now.
I don't know if they're our friends now.
They're warming up to us. They're warming up.
Yeah, definitely.
Can a minor scarring cause a lining that once was able to get 10 to 12 millimeters now only gets 7 millimeters?
Yes, because if it's scarring front to back wall, if you've got a scar there like that, it's going to prevent the lining from thickening because it's literally holding it together. So that won't work. You have to get the scar cut.
You know, I'm watching our show on all these different screens and things.
Yeah.
Our show is pretty good. Just letting you know, like if I was scrolling through and I saw 2 people talking and one of them knows a lot of stuff and one of them knows a little bit less, I would tune in. I would tune in just a little bit less. Yeah, that's right. That's how I worded that.
We got to do one from the cottage.
You know, it's very possible.
We could do that.
We could do that. It'd be amazing.
We do cottage
version.
Cottage fertility.
Yeah, cottage. Yeah, absolutely. Hey, I'm there.
Yeah, I know you are.
I'm there.
Yeah.
I will not be the problem on that
one.
Any ideas on why my AFC and egg counts are way off? I averaged 30% of my original baseline follicle count.
That was a lady that asked that earlier.
Oh yeah, that's a repeat?
It must be, yeah. I don't. I mean, as I was saying earlier, we don't know why some people have a high AFC and their eggs don't respond. Could be FSH receptor mutations. There are people where their FSH receptors are mutated, so it doesn't recognize the FSH molecule from the drugs that you're taking. It could be something physiologically problematic. Those are probably the 2 most common problems, but there's no way to know exactly why.
An embryologist question. Any thoughts on how embryologists can determine which sperm has DNA fragmentation?
You can't. You can't determine which sperm has DNA fragmentation.
You want to go?
Ready?
Yeah, I was going to go to another question, but you
can.
Real quick.
So here's the problem. If we do this sperm DNA fragmentation test to figure out which sperm has a problem, the issue that you're going to run into is that you're going to end up with destroying that sperm. So you can't use the sperm after you figure out if it has DNA fragmentation. The new devices that we use for sperm prep, Simo, Hamilton Thorne has one, or LensHook has one that we now use. There's different micropore, microfilter devices that isolate the sperm. They tend to retard the progression of the sperm with high DNA fragmentation very significantly. So Zymet is 90%. I think this new one's 95%, they claim, is really high. So you can very significantly drop the amount of DNA fragmentation doing that. Even easier, ejaculate once and then 3 hours later do it again. In the second sample, you'll have 80% less DNA frag. Easy. As long as you can do that. Not every day.
Any thoughts on how embryologists can determine which sperm? Oh, I just did that. Sorry.
Yeah.
How long of a wait is it for a lap? Can you schedule this specifically during suppression, or do you need to take any available slot?
Yeah. So we try to schedule it during your suppression. Unfortunately, we are at the mercy of multiple different forces, and I got to be careful about what I say, so I'm not going to go on a rant. In our community here, where we don't have access to as much OR time as I would like. Once upon a time, I had 1 day a week. Now I'm down to 3 days a month. So it is difficult to get OR time, not because I don't need it, believe me, I do, but because of the fact that it's very difficult to get. Now, we do currently do hysteroscopies in the office, which has cut down a lot on my OR time, so we're better. I'm actually getting an entire laparoscopy set up, but we're not sure how we're going to do that. And I don't know that I could do that in the office setup we have right now. So
I could probably just go in there and
you just zip it on in there.
I
Yeah.
could do it.
No. They made Jenna do it in a model.
Oh, really?
And she had to, they make you pick up keys.
Oh.
So you got to take the grasper and like,
Oh, yeah. All right.
So apparently she was wicked at it.
I would be wicked at it. It's like eating with chopsticks. I could just get in there.
So yeah, I'm excited about my baby learning. But
in fact, when I was in China, people were blown away that when they would serve me my meal, I could do chopsticks, and they were like, "Wow, look at you!" And I was just like, grabbing them. They couldn't stop.
You were going full crab.
100%. They lost their mind. They're like, "Don't you want a fork?" I said, "Forks for suckers." I was authentically Chinese.
That's awesome.
I roll with the culture wherever I am.
And we have lots of practice because we eat sushi here all the time.
That was what reminded me of the story. Hey, Dr. Victory. I'm on the vaginal progesterone. I take 2-3 times daily.
Uh-huh.
I am 11 weeks, 2 days, wondering how long I continue it for.
In our practice, you should talk to your doctor. But in our practice, at 12 weeks, we cut it down in half. So 1 pill 3 times a day, and we continue till 36 weeks.
Dr. VNT! Exclamation mark, exclamation mark, exclamation mark.
There you go.
It might not be a DR, but
attention grabber.
Attention grabber, absolutely. If you have suspected endo and you follow endo protocol and you don't have endo, is there anything to worry about?
That's a great question. So the endo protocol we use has suppression, which would have no negative impact. It has lots of supplements, which should not have any negative impact. It does have high dose progesterone. Now, high dose progesterone is useful in endo patients because they are progesterone resistant. And so it's beneficial for them because they're progesterone resistant. So you need more to get the same impact. But in non-endo patients, you could, in theory, overdo it. And if you overdo it, you're in trouble because now you have given the patient too much progesterone. You can kind of overdo the lining, and that can actually have more of a birth control effect. So yes, it's possible it could be detrimental. From an immune standpoint, if the patient has no immune problems and you over suppress their immune system, sure. I mean, if you prevent them from having normal immune function, they may have catastrophic effects. So I would not be in favor of doing it for people that don't have endo. We do generally want to know for sure that you have endo. And that's a great segue into this whole new flurry of tests, like from Australia. And we're doing research for one in California, and there's already one in Canada, and there's that Receptiva that's been around forever. Yeah. So far, I haven't seen the data on the Australian one, but so far, nobody has a test that is yes or no. Okay. Now, I haven't seen the Australian data, but nobody has a test that says, yes, you have it or no, you don't. It's like, here's your percentage chance. You've got a 93% chance, or you've got a 82% chance, or that doesn't mean anything because you still might have it or you might not. So if it's like, 99%, 98%, okay, I'm willing to take that. That's reasonable. It can change whether or not I need to operate on you, whether or not I need to offer you an endo protocol and so on. But in the absence of knowing like almost for sure yes or almost for sure no, it's useless. It doesn't tell you anything. You're spending money for nothing. So we started doing it and then the company shut down, and I'm not going to go back to doing it because it doesn't help. Like it's only going to be useful in cases where I can say, yes, it's helpful or no, it's not. Now we are doing research for a company that claims their test is actually diagnostic. So it does say yes or no. So we'll see. But until I find something that's like 100%, I'm a.
And with that, how soon after birth would you consider doing an embryo transfer prep?
Minimum 6 months because we want you to breastfeed. Breast is best. So make sure you breastfeed for 6 months, preferably a year. And it also depends on how you delivered and how you want to deliver next time. So if you delivered vaginally, 6 months is fine. If you delivered cesarean and you want another cesarean, 6 months is fine. If you delivered cesarean and you want a vaginal delivery next time, you need a minimum of 15 months.
Do you do cord clamping at Met? I'm due in May.
I think they meant delayed cord clamping.
Followed comment, delayed cord clamping.
Yeah.
I can only read one line at a time. There's only so much I can read. I got multiple screens going.
There's a lot
of windows moving here.
So we automatically all do 1 minute of delayed cord clamping. Keep in mind, for term babies, there's no benefit to doing delayed cord clamping, but we do it for all of our patients, yeah. Except when you're doing cord blood sampling for like keeping the cord bloods for stem cell. So for that, you can't. You have to go ahead and get the stem cells or else you'll run out.
Fertility Doc says I have endo. Said I can do surgery for IUI or retrieval surgery, then transfer. Guess they're asking if that makes sense.
So if you have endo and you want to do IUI, you should do your surgery before you do your IUI because it's going to improve your chances with your IUI. If you want to do IVF, it's make your embryos, then do your surgery, then do your transfer because the IVF will actually make your endo worse.
Tips for OHSS, 9 days post-retrieval, transfer canceled, freeze all. How long should I wait for the FET?
First of all, I'm sorry you got OHSS. It's generally pretty avoidable these days, but not 100%. You only need to wait like 2 months usually, and you're back to normal. I mean, you'll probably be fine within a week, but I'd give it an extra week or two for your ovaries to shrink down, and then you should.
I've been following you for years.
Oh, wow.
And I'm finally pregnant.
Yes! Woo! On international, not television. Web.
This is as good as TV gets.
It's as good as TV
I watch
gets.
more YouTube than I watch TV.
Isn't that awesome?
Right?
We have a post that I'm going to post about this lady that said, I've never seen you before, but I followed your advice. And after years of failures, I got pregnant, and I owe it all to you. It's a really sweet post. I love those ones. I mean, we didn't even.
What about?
And you?
Yeah.
Yeah.
Yeah. Come on.
So I love getting those posts because it's so heartwarming to know that we can help people. And then people are so desperate. And we put out some posts recently about people being charged $100,000 for 3 cycles of IVF, and people getting kind of suckered into things. I talked to someone today that had some just absolutely bizarre protocols, which obviously weren't right for her. She clearly has endo. It was ignored. I see it all the time. And when you see that, it's so heartwarming to know that we provide a free service helping people to achieve the success that they want and need and deserve. And we're not asking for anything in return. Well, maybe bring us some followers. Throw out some likes.
That's all we
Oh,
want.
yeah,
Just some likes.
Some likes,
Some
yeah.
likes, some shares.
Some shares. Some
If you
likes.
benefit or your questions asked or answered,
Yeah.
or you thought something I said was inspirational and motivational, just let people know.
We should have like a minimum of if you get an answer to your question, you have to bring us a couple of followers.
I think that's the bare minimum.
That's a bare minimum.
Like you know
Or
what?
brownies.
Brownies.
Yeah. Heather, I know you're watching. Love the brownies.
I love it when he gets the brownies.
Oh, those brownies were legend, weren't they? They were very good brownies.
Hi, Dr. V. I'm wondering, what immune meds do you recommend for FET coming off of 3 months of Lupron and Letrozole?
It depends on what condition you have. If it's just for endo, we do steroids, interlipids, and either sirolimus or tacrolimus. But it depends if you have other immune conditions. If you have high NK cells, we would add other stuff. So you might add Plaquenil. If you have high cytokines, we might need more than just the tacrolimus. So it depends on what's wrong.
What is your recommended protocol for DI bowel endo after successful IVF pregnancy while waiting until ready for next transfer for endo suppression?
Deep infiltrating bowel endo.
Oh, okay.
And they're what?
After a successful IVF pregnancy while waiting until ready for next transfer.
Oh, suppression. We would just do our endo protocol. You got endo, we run our endo protocol because it's awesome. It works.
I also love your endo protocol.
It is a very cool protocol. It does work. It took a long time to put
it's the victory protocol.
It's the protocol to victory.
Yeah.
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 It's the victory protocol to victory. Yeah. Yeah.
Do you ever not recommend suppression after laparoscopy before an FET?
Only if there's no endo. Then I wouldn't. But otherwise, it doesn't make sense not to. No matter how good the surgeon is, and I pride myself on being a pretty good surgeon, you're never going to get it all. It doesn't matter who you are. You're never going to get it all. There's always going to be some endo. So if you're leaving some behind, you got to make sure that it gets addressed.
Sorry, didn't finish my question about sperm DNA fragmentation. My husband has excellent numbers in morphology, etc., but a decent amount of DNA fragmentation. What can be added to ICSI?
Okay, so do all the things to reduce his fragmentation. So number one, make sure he's ejaculating every day or every 2 days. Number two, no smoking, no drinking, no drugs. 0. People are always like, oh, I cut down. No, not cut down. 0. You can't smoke, you can't drink, you can't drug. Number 3, take fertility vitamins. Number 4, keep the testicles cold. Number 5, ejaculate twice on the same day, 3 hours apart. Use the second sample, not the first. And then the last thing, get them to use a device that screens out the sperm with high DNA frag. So Zymet or Took or whatever. They all do the same thing. The microporous sort of filters for sperm that we now have available to us get rid of a lot of the DNA fragmentation. And they know that because they've tested the sperm before, and then they've done DNA frag on the test that comes out the other end. And it shows that the DNA fragmentation is massively decreased. So that's how.
How long after a C-section can you drive?
When you can slam on the brakes, you can drive. So you got to make sure you can jerk your foot back and slam it on the brakes. And if you can, then you're fine.
What are your thoughts on letrozole in combination with Lupron in an endo patient?
That's what we always do. My thoughts are awesome. That's the victory protocol. So we do Lupron and letrozole. We kind of popularized that by telling everybody about it because no one was doing that. So Lupron and letrozole have shown benefit in 3 different studies. So that's what we do.
Why is it important to still do PGT if using donor eggs? If it's not recommended, if I were 26 years old, why do I need to do it if the donor is 26?
You don't. It becomes a cost issue, and that's probably the only reason to do it. Although we do have donors that produce a high number of genetically abnormal eggs, like as high as 50%. or embryos, I should say. But the reality is you don't have to do it. The important thing to note is if you make 10 embryos or 12 embryos, because we typically with our donors make a lot, then you don't want to be trying, this one and that one and that one, and then you get the good one. You want to know which ones are good, so you go straight to those. So there are some financial advantages to narrowing it down, but if you only had let's say 6 embryos, I would never encourage someone with donor eggs to get PGT on 6 embryos. It's different if you're using a surrogate, though. Keep that in mind. The surrogate community, God bless them, I love you all, they don't want to use genetically untested embryos. And so if you're looking for a surro, you need it because otherwise it's actually harder to find a surrogate.
Going back up here a little bit.
You do have a lot of screens going on.
It's not a joke.
There's a lot of action.
There's a lot of action going on. Yeah. Because now, because Instagram's not working here, usually I had my phone for Instagram, but now everything's here. So now it's just trying to do some of this. Yeah. Okay, here we go. Trying to conceive for 10 months and did my last IUI in the TWW. Is there anything I can do to help my chances? That's one of two. There's a second part.
Wait, let me answer that one first.
Okay, go ahead.
During the 2-week wait, aside from eat healthy, try not to stress too much, diet, exercise, there's nothing. Take your vitamins, take your supplements, pray, meditate, yoga, light exercise, healthy diet. That's it. There's nothing else you can do. You're not going to change it. Okay, part 2?
Couldn't find part 2. I don't see it.
Oh, all right.
Part 1, do your best. Another question. Oh, hold on. Yeah, okay. So, just trying to do here. Okay. I had 2 euploid chemicals and just tested positive for chronic endometritis. Could this be why?
Absolutely. We know that endometritis is a massive decrease in chances of success and increased risk of miscarriage and failure. So yeah, absolutely. Endometritis can be the cause. Testing for chronic endometritis, unless you did a PCR-based test, is useless. So don't bother doing non-PCR-based testing. So if you're not doing a microbiome test that identifies the bacteria and isolates them and figures out which ones are normal and not normal, you're wasting your time. And there are companies that claim they know how to do that properly that don't. I won't go into details because I don't want to get in trouble, but be careful about who you choose. I will happily say we use Fertility. I have no financial involvement with them, but they're a great company and they know what they're doing. I have less faith in other companies.
Can you have twins again right after losing?
Yeah. You can have twins with any pregnancy. Just because you've lost twins doesn't mean you can't have twins. Now, if you're asking would I put in 2 embryos into somebody that just lost twins, no. That would be very unfair.
I reached out on via DMs, and you mentioned that the numbers didn't add up. Can you explain, please? I think on TikTok she reached out to you, and she says you told her that the numbers didn't add up. Can you explain
what we're referring to? I get 1 million messages a day.
Yeah.
If it may have been the AFC and AMH question. So if you have a high AMH, you should be producing a high number of eggs. If you have a low AMH, you should be producing a low number of eggs. If you have a high AMH, you should have a high antral follicle count. If you have a low AMH, a low antral follicle count. So if that's what you're referring to, possibly that's what it was. Because I think I messaged someone on TikTok about that. Interestingly, we don't get that many questions on TikTok. Like our TikTok account is
it's slightly dormant for some strange reason.
It's not dormant. It kind of puts along and it grows a little bit at a time.
A little bit of putts going on there.
But it doesn't. We don't get questions on it.
People don't know. They can ask.
Yeah, I don't know.
They will today. You should see your TikTok today.
Crazy.
Well, they're asking questions today. How to get rid of bloating after retrieval?
Walk. Go easy on the narcotics if you can. We don't want you in pain. Don't eat foods that'll make you gassy, but there isn't really a great way. I mean, we're giving you narcotics. It's going to get you constipated, plus the bloating of the pressure of the ovaries. So all that stuff takes time. High protein diet, Gatorade, those will help. What time are we at?
45.
Oh yeah.
But I got one for you.
I got a shout out for my wife first.
Go ahead.
We needed parts for our bed, our OR bed today.
Good to clarify that.
Yeah.
That's important. Shout out to my wife. We need parts for the bed.
We needed parts for our bed. We needed parts for our OR bed.
There we go.
And they were in Ohio. So I actually called my wife in the morning. He said, you need to go to Ohio. Because we cannot wait. So my darling wife, God bless you. I love you, Wendy. You probably are here somewhere right now hiding. Thank you for going all the way to Ohio to pick up parts for our bed. And they should be in the back there with the guy now fixing the bed.
Yeah.
Hopefully. Yeah. If it's not fixed by tomorrow, I am going to kill myself. But anyways.
This is available.
Yeah. Yeah.
Might not be as good though. A question that you will love to death, I'm sure.
Oh God, no error.
I just did an ERA last week, and the biopsy came back with polyps. Do I need to remove them before the FET?
Of course. Yeah, absolutely. Polyps before FET.
Currently trying to conceive. It's been 4 months of trying. What is your best advice?
So I would follow the guidelines for that because they are pretty good. Less than 35 years of age, regular periods, try for a year. 35 to 37, or even if you want to say 40, try for 6 months. Over 40, try for 3 months. All of those are regular periods. If you don't have regular periods, see your fertility specialist right away because that's not safe, A. And B, you're going to need help. So regular periods, a year less than 35, 6 months, 35, 39, or 40, and over 40, 3 months. Not regular periods, go see your doctor right away.
My friend is 38.
Okay.
She thinks her womb may not be healthy. Womb.
Okay.
Yeah, may not be healthy.
Yeah.
What did you hear?
I thought you said room.
No. Womb.
Womb. Okay. Yeah. Womb.
WOMB.
Okay.
Because she had 2 failed IVF treatments within donor eggs.
Oh.
Her OBGYN said she has ovarian failure with an AMH of 0.015. What can she do? And there's no PD.
PD. I don't know what your PD stands for, but what can you do? Contact me because that's what we specialize in, figuring out the tough cases where other people couldn't figure it out. So contact us. We'll go through it with you. We'll figure out what's wrong. Immune testing, microbiome testing, looking for endo, adeno, shape of your uterus. All of those things are critical. We truly succeed where others just don't.
There is a comment on YouTube.
Yeah.
In response to your comment about there's nothing you can do to have a boy.
Yeah.
I'm reading the comment here.
Yeah.
I'm reading it.
Read it away.
Dr. Natalie Crawford posted something about how to have a boy on Instagram today.
Oh, really?
Really?
Look at that. I've spoken to Nat.
I told you, it's Wednesdays at 3 o'clock.
Yeah. You said Thursday. Now it's Wednesday.
Depends what you got free. You know what I mean? The main thing's 3 o'clock, I think. That's kind of what you got to go for.
I'll have to look that up. To the best of my knowledge, there's absolutely no way to determine male from female using any conventional technique aside from sex selection. You want to grab my phone and I'll look up Nat and see what she posted?
Yeah,
that would be fun.
Let's do that live. That's fun.
That would be fun. Yeah, let's do that.
Let's get to the bottom of this.
I'll do it.
It's a riot. There you go.
You can look up the next question.
Yeah.
Look up what Matt said.
All right, next question. Here we go. See, we research on the show, after the show, during the show. It's just a show designated to fertility.
We are all over it. Oh,
is it true?
Oh, I don't know yet. I'm just
Oh, you're still going?
Natalie.
Oh, okay, okay.
There she is. Okay, here we go.
Do you want me to ask you a question? Or you got it? You're in the zone here.
I don't know. This is her walking downstairs saying it wasn't easy to get pregnant. Oh, that's her pin.
This is what science looks like.
No, I got nothing, man.
Today they posted it, she says. I don't want to look it up because I hope we don't mess up the live.
No, nothing that I see.
Guys, don't let us down here.
I don't
When
see
you tell us they
anything from
post
that.
today, we check today. We are real time.
I don't see anything from today that says how you get a boy versus a girl. Yeah, nothing. She is extremely photogenic and a lovely person. And holy cow, does she have a lot of followers. Insane. Yeah. Okay, fire.
Okay.
You know, she was probably not known. Natalie Crawford was the originator of fertility social media.
Oh, really?
Yeah.
She was the first one to do it?
She was the first one to go big.
Oh.
And when she was at the beginning of this is just immediately pre-pandemic, she had like 50,000 followers. Today, 223,000.
Oh, wow.
Yeah, on Instagram. And several people have shot ahead of her, although they're not all real accounts, as we know.
Yeah. That's what we know.
Yeah. Do we creep occasionally?
We call this research.
Research.
It's called research.
All right.
So my RE doesn't endorse Fertility, of course.
Okay.
After multiple failures, I just did and got the results. I'm worried it's a strong antibiotic and I would throw the balance. What's your recommendation for the duration?
Oh, I don't know. I need to know what's wrong with you, dear. So message me and I'll be able to help you. But I need to know what bacteria you have, what balance there is. I will say that we've been doing this for a long time. I would happily say, if not the world's expert on this now, I got to be up there with the best of the best because we've been doing it longer than anybody has. There is absolutely no question. It can be brutal trying to eradicate the bacteria. Sometimes it is exceptionally difficult to get rid of the bacteria and clear it all. Very, very, very difficult. So we've turned to doing uterine washes. We've used naturopaths for their protocol. We've, tried lactobacillus. We've tried this, that, and the other thing. Is this Nat? Can you? Oh, okay.
Are you trying to determine the gender of your next baby? Well, this is not 100% different. This is called the shuttles method. And the premise here is that sperm are either X or Y. And the X chromosome we know is heavier than the Y chromosome. So the Y sperm can swim faster than the X sperm. So if you're trying to time intercourse around having a boy or girl, if you want to have a boy, you should not have intercourse at all until the day of ovulation, then have intercourse, with the thought that the faster sperm will get there and the slower X sperm are less likely. If you want to have a girl, you should have intercourse 3 days before ovulation and then abstain through ovulation.
Tested, tried,
The idea
doesn't
of
work.
those fast sperm moving out of there and totally
Nope.
it's not scientifically proven.
Yeah, exactly.
It's actually not been found to uphold, and I do not recommend if you are having infertility to have less intercourse.
Thank you, Natalie. There you go. You redeemed yourself from that last few seconds.
I think
because I was getting worried. Yeah.
I think Wednesdays at 3 is a better way.
Yeah. There is no way to select the sex of your baby naturally. I know people that swear that they can. It's all total nonsense. It just doesn't work. Yeah.
I know people that gave up having kids because they were worried that they would have another of the exact same gender. They're just like, I can't take the risk.
There is someone local who you may or may not know who was so hell-bent on having a child of one sex that they went to the States, spent over 100,000 US trying to have that particular gender.
Mm-hmm.
Didn't work at all.
Oof.
Came back to us. I realized, oh my God, the sperm is like the worst ever. We started the IVF process. We made them a bunch of embryos, told them flat out, I can't test. Before we could get to the point where we got her pregnant, she got pregnant and had the opposite of what they want.
Oh, wow. Oh, wow.
So I always use that story to tell people, yeah, don't go for sex selection. It's a waste of time.
Hi, Dr. V. What is your protocol for women with PCOS 2 to 4 periods a year?
So that's dangerous, right? So having only 2 to 4 periods per year is absolutely dangerous for your health. You're at risk for endometrial cancer, endometrial hyperplasia, all the side effects of PCOS, and probably breast cancer as well. You cannot go through your life having irregular periods, no matter what anybody tells you. You must be regular. And regular means you are ovulating or you are on some kind of hormonal control of your overall cycle. So with that in mind, if you are having irregular periods, make sure you are either seeing a gynecologist that knows what they're doing, because I hear all the time about gynecologists saying it's okay to not have regular periods, or see an RE who will help you get you regular.
Hi, Dr. Victory. I'm on vaginal progesterone. I take 2-3 times daily. Did I?
Is that the one where she says what to do at 11 and 2?
Yeah, wow. I'm just trying to survive the comment section. That's all I'm doing. I'm just trying to survive here.
I want to know what everybody thought about that spinning bed. Was that not the stupidest?
I seen that and I said, there's no way Dr. Victory could comment on this because it's so ridiculous.
My favorite part is the part where the kid comes flying out and actually clunks its head off the bed. No, off the bed first, does his somersault, the full 360, careens into the net, and then bounces.
Just in case the doctors aren't paying attention. I believe that's what they said. Just in case the doctors
Where the hell am I going to be in that delivery? I'm not getting near the bed. I'm going to get.
You're going to throw it away.
Yeah. I'm going to break every bone.
That's the modern day of delivering babies, I guess.
That was the dumbest thing I'd ever seen. And then someone said it's like a giraffe. Did you know giraffes do that?
They do what? Spit into a net?
No.
What part of this can a giraffe actually do?
Apparently they spin around to help like shoot the kid out.
I don't.
That's what
the comment said?
I've never seen. I don't think I've ever seen a giraffe birth before.
No, me neither. I'll be honest. To be
That
fair,
would be wild.
That would be wild.
Yeah.
Wow. Sometimes now I'm wondering if these things are actual real pulse or are these just these jokes? Similar like the egg one.
I mean, that easily could have been a chat. I mean, in video AI or one of these.
You don't know anymore. We
gotta start making weird stuff.
And just let it go viral. Here's the latest way. Have you used low dose naltrexone as part of your immune protocol for endo to help modulate the immune system and reduce inflammation? If so, what dose do you recommend?
Total number of studies evaluating the use of low dose naltrexone in infertility is 1, and that one study is exclusively in women with PCOS, where it showed a very slight benefit. There are no studies demonstrating any value whatsoever at all to low dose naltrexone in infertility patients as of a month ago. So no, I'm not using that until there's proof. There's a very famous clinic in the States that's putting everybody on it. They also just throw the kitchen sink at you when you have a failure. I don't believe in that approach. That's amateur night. We don't do that.
I'm not sure what this means, but maybe you do since you're the doctor.
Okay.
I'm in a stress pill. Can I be pregnant?
I'm in a stress pill?
I'm not sure if that's a question or a strange comment. Okay, so it's not just me, you see? I don't know, you don't know.
Maybe she's on an antidepressant or a pill for her stress. Can she still get pregnant? Depends on which one.
A negative test result. What could cause all the cramping?
I need more details on that one. If you mean a negative beta, but you're crampy, I mean, if you were given gonadotropins and you had lots of corpus luteum, as they shrink, it can cramp and cause pain. If you had a higher estrogen level than you normally do and you're getting your period, that can cause cramping and pain. Any of those sorts of things are possibilities.
Anxiety pills. Is what they're referring to. If
Yeah.
they're on anxiety
So
pills, can they still
that's
get
what I
pregnant?
thought. So yeah, it would depend on what
Um,
you can still get pregnant on many of them. They do have side effects for the fetus, but it's not 100%, and your mental health is important, so we value that.
Hi, Dr. VT, can you share your thoughts?
Our thoughts.
Our thoughts, yeah.
I got that.
Yeah, on a segmental with a extra piece of chromosome 1. Curious what outcomes could be seen with this. Would you transfer it? I personally wouldn't, but
A high mosaic, yes. A low level mosaic, definitely, because that's a normal embryo. An aneuploid, I actually still would, because 40% of the segmental aneuploids are actually mosaic. And so, or high level mosaics, so they could actually still be a normal baby. It's a 30% chance. I mean, overall, that gives you a 12% chance, but it's a chance. Why not? 9 o'clock, dude.
9 o'clock, dude. Let's go.
We got more? Or
You got more.
okay, so we're gonna call it quits because I gotta go fix the bed. Thank you for watching the show. Next week we still have a show,
Yeah.
right?
Well, yeah.
Yeah,
Why wouldn't we?
I think the week after. I mean, you're.
Without me?
Yeah,
My heart breaks every time I hear things like
I'm
that.
going all the time. Anyways, we will be back. Do us a favor. Tell us some topics you want to know about. Like, I'd love to just do a topic one day. Like, let's talk about endo, or let's do whatever. We're also going to have our friend Endo fertility dietitian on with us soon. We're going to have Carly on, or I'm on with Carly, one of the two. There's a bunch of other people we're going to be bringing on. So yeah, we'll do some interviews and stuff as well. Stay tuned, and we will see you all next week on Fertility Type Fiction. And if we didn't get to your question, send them to us. We'll answer and turn them into little posts.